Hi everyone, I'm Sadie White and I was assigned Apraxia, I believe it's pronounced, I'm not really sure. So we're just gonna learn a little bit about that today. So these are some accommodations, but I'm going to skip this for now and come back to that a little bit later. So introduction to Apraxia. It's a neurological speech disorder affecting oftentimes children, but of course it does reach into adulthood. It is a brain disconnect between, like, when you think I want to say something and it actually getting out of your mouth. It's not necessarily a muscle weakness. It's nothing that anyone has done wrong. You can't really prevent it. There's really no treatment. So it's kind of just something that is, and we just have to kind of deal with it and accommodate as we go. So, a little bit about it. It is, like I said, it's a speech-specific, kind of like motor disconnect in the brain. So maybe a student will slur their words or skip over words and not get them all out. It's very tricky to have a fluid conversation with somebody who has apraxia. So, and like I said, it's very important to know that it is not caused by muscle weakness, and there's nothing that the student or the child or the parent could have done to prevent this. It's nothing that anyone has done wrong. And as educators, it's very important to understand that, because we want to make sure we're creating an environment where our students are never being made fun of. So if we know that, we can teach that to the other students and they can be respectful. So behaviors. So a student will have inconsistent speech, kind of disoriented, like a confused tone. I'm sorry, I don't have this fully. Groping mouth movements. So it will just look like they're just trying to talk and they just can't get it out. It's like their mouth's moving but no words are coming out, and it's very, very frustrating for them, as we can imagine, because you're trying to speak and you just can't get it out, and I can't imagine. So it's very important to be conscious of this as teachers. So causes, this is very important. There's a few genetic links. Sometimes it can be caused by a brain injury, such as like a car crash or a traumatic event, shaken baby syndrome. And then it might occur with other disorders, like they may coexist. So they don't hurt each other, but they're definitely not helping each other. So it's just only getting worse. So that's a few causes of it. And then a diagnosis. If I'm remembering correctly, there's no treatment for this. You can have a speech and language therapist or like pathologist who can kind of help the student or child like grow their speech ability. It's really important to rule out hearing loss when you're diagnosed, because it is very common in deaf people in general, not just students, but everyone. They have a hard time talking because they can't hear the sounds that they should be producing. So it's important to rule out the difference between deaf or hearing loss and apraxia, because they are very different, but they look the same. And then a dynamic assessment of speech and motor planning. That a student who has apraxia should be seeing a speech pathologist on the regular to rule out other things and make sure we're not getting worse, make sure just everything's healthy. Because even though this is a kind of thing that you can't really treat, you want to just obviously make sure that everything is healthy. And then treatment options. Like I said, there's really no treatment options. You can do individualized speech therapy, repetition and structured practice, motor learning principles, visual and tactile, cueing support progress, and alternative communication when necessary. So there's no medication you can take. There's no surgeries that can be had. This is just something that children have and will take with them into adulthood. And maybe they can kind of, get better at their speaking, and maybe not. And having a speech therapist can really help students because it's hard to get the words out, and learning how to move your mouth and use your vocal cords, that can really help. So really just going to therapy is the best treatment option. Okay, implications. So students will probably have academic challenges in reading and writing. Probably not math, because math is so numerical. It's just very clear and cut. They'll have social frustration, isolation, due to their communication barriers with not only the teacher, but also their family, other students, things like that. It will require a lot of family involvement in this student's life and educational journey. The parents will need to consistently be in contact with the teacher, with the speech therapist, things like that. Teacher awareness supports classroom learning. This is probably the most important thing in this presentation. When a teacher is aware of a student's disability, not only Apraxia, but just any student in general, they can learn and become knowledgeable and become a good support for the student and become a good educational kind of resource for the other students to learn how to treat the disabled student with respect and with boundaries. If a teacher is just ignorant to it, they're not gonna flourish in the classroom with the other students. So it's very important for teachers and parents to be stepping into the student's life to help them grow. What can teachers do to help? Teachers can provide visual aid, like pictures, videos. They can allow extended response time. So like if you're giving a student 5 minutes to talk with a partner, extend it to 10, things like that. Collaborate closely with speech language pathologists. Like I said in the last slide, if the teacher is connected with the parents and the therapist, they're going to know more and be a better support for the student. Offer positive reinforcement for communication attempts. Just being encouraging. Encouragement is honestly the fastest, quickest, most effective way to build relationships and get students to where they need to be. Use small groups or one-on-one support for oral practice. Having students work with a buddy or a group of 3, it's less pressure, it's more comfortable. They can get their words out easier because they don't feel like everybody's waiting for them to mess up, which is really important. And then maintain patience and reduce classroom communication pressure. Like I just said, large group presentation, that's stressful for all kids, but especially if there's a language barrier. The child is no longer thinking about rocks and science. They're thinking about, oh my gosh, I can't say this word. What if I don't get this out right? What if it doesn't make sense? What if they laugh at me? So we do not want to create a stressful environment. We need to reduce stress at all costs. So here's just a list of my sources, and then additional information. So let's go through this handout. Oh, I'm sorry. How do I present? Okay, I'm not sure how to present on Canva. I thought I had linked that way, but we can just go through it like this. So, this is just kind of a handout of all the information that a teacher or kind of like paraprofessional would want to have access to when working with a student with apraxia. It has sources, it has links, it has definitions, it has implications and adaptations, and it is just super helpful. And then this outline here is just showing kind of what each slide talks about. So this is something that I could look back at as an educator and use kind of as like a source for if I wanted details or information about it. And then if we go back to my accommodations, my first accommodation is a speech app. So I will play that video now.
Hi,
My second accommodation for students with apraxia would just be just general things that a teacher can do. So like, for example, I can type instructions. Sorry, I was looking at this. I can type instructions. I can provide videos with captions. I can pair students in a buddy system. I can allow students to write or type or speak up to them, just so that they have a learning that is not necessarily catered to them, but is fit to their needs. So this way they can learn without the stress of speaking. So for example, I can allow them, if we're doing a group assignment or a group project or a research and we're going to present to the class, they can type or use the talk to text or something to make a video or something rather than the traditional way, just so that they don't have to worry so much about their abilities and they can just focus solely on their learning. Hi, my second accommodation for students with apraxia would just be, my next accommodation is, let's see here, just kind of like implications you can do in class that not all students need, but students with apraxia will appreciate. I am researching ways to help students with apraxia, which is a speech and language issue. So one accommodation I can provide my students is an app. There are a few different types. Let me see. Apple has an app for this, just a general like MacBook situation. 11 Reader or Speechify, which is the example I have listed. These apps you can speak to them and they will make text, or they can take text and say it to you. So this might help a student who needs to kind of follow along or try speaking or just anything really. It just helps with their language. They can hear other things and get more familiar with it. And this is really helpful also if another student with apraxia is gonna, like, if they're gonna communicate together. So I don't know. It's just very helpful, and it just seems like something that I can provide and allow to help them. Hi. Alrighty. Oops. So that concludes my presentation about apraxia. There are obviously many things that students can use and teachers can use to not only accommodate, but just make sure that there's a healthy environment, like fulfilling UDL and just all of the different things that students need to be successful. So, thank you.